Welcome to POTS 101, where I tell you most of the things you need to know about POTS. Let's get into it. POTS stand for Postural Orthostatic Tachycardia Syndrome. Postural meaning body position, orthostatic meaning standing upright, tachycardia meaning a fast heart rate, syndrome meaning a collection of symptoms. So what is POTS? POTS is an autonomic nervous system disorder, a kind of dysautonomia. So what is dysautonomia? Dysautonomia is an umbrella term used to describe several autonomic nervous system disorders. The autonomic nervous system regulates the involuntary responses of the body. That means heart rate, blood pressure, respiration, digestion, pupil dilation and constriction, and many more. With dysautonomia, the autonomic nervous system is not functioning properly. This can cause dozens of symptoms across multiple body systems. So what are some common symptoms of POTS? The hallmark of POTS is an increase in heart rate of at least 30 beats per minute within the first 10 minutes of standing. So tachycardia, it's in the name, is a very common symptom of POTS. Other common symptoms of POTS include shortness of breath, nausea, fatigue, lightheadedness, dizziness, chest tightness, heart palpitations, fainting called syncope or near fainting called pre-syncope, temperature dysregulation, excessive sweating, and more. Now remember, dysautonomia is an umbrella term used to describe several autonomic nervous system disorders. Since there are several different types of dysautonomia, they're still under that same umbrella. So for a lot of these disorders, there's so much overlap in symptoms and in how they're treated. So what happens in the body of a person with POTS when they stand? When a POTS patient stands, their autonomic nervous system activates several responses and releases hormones that tell blood vessels to tighten. The blood vessels don't respond efficiently to that signal to tighten, which causes the heart to beat faster in an attempt to compensate for the lack of efficient blood vessel constriction. The heart is also beating faster because it is attempting to maintain adequate blood flow to the heart and the brain. So the longer the patient stands, the more blood pools in the lower half of their body because of the lack of efficient blood vessel constriction. This of course then leads to the heart continuing to beat faster, trying to compensate, not enough blood getting back up to the heart and brain, which causes symptoms like lightheadedness, dizziness, fatigue. So how is POTS diagnosed? First, let's go over the internationally accepted POTS diagnostic criteria. So first, there must be a sustained heart rate increase of at least 30 beats per minute within 10 minutes of standing. For individuals who are 12 to 19 years old, that heart rate increase has to be at least 40 beats per minute. Now, the diagnostic guidelines for POTS don't specify how long that 30 beats per minute or more increase has to be sustained. And that's because experts have been urged to avoid creating arbitrary requirements like the heart rate increase must be sustained for 3 minutes because it's not based in science. The POTS heart rate criteria was developed based on percent deviation from the norm, and no time duration for the heart rate increase was used in the initial studies that set the POTS heart rate criteria. So that's the first piece of criteria that must be met. The second is that there must be an absence of orthostatic hypotension. Orthostatic hypotension, or OH, is a decrease in blood pressure of at least 20 systolic or at least 10 diastolic within the first 3 minutes of standing. The third piece of criteria that must be met to get a POTS diagnosis is that there must be frequent symptoms of orthostatic intolerance when standing that rapidly improve upon returning to the supine position. The fourth piece of criteria is that there must be a duration of symptoms for at least 3 months, which makes sense. It's a chronic illness, right? And then finally, there must be an absence of other conditions that could explain the tachycardia. Now, this specific piece of the POTS diagnostic criteria can be a little bit confusing because it lists several conditions that they say there must be an absence of. There must be an absence of anemia, anxiety, hyperthyroidism, and many more. So does this mean if you have anxiety, you cannot have POTS? No. Think of these as conditions that should be ruled out or treated before POTS is diagnosed. For example, if the tachycardia is only due to dehydration and the tachycardia resolves when the dehydration is treated, then it was dehydration and not POTS. If the tachycardia is only due to anxiety and the tachycardia resolves when the anxiety is treated, then it's also not POTS. But it's possible for people with POTS to have two conditions at once. For example, if dehydration is properly treated and the tachycardia still persists, then someone could have had dehydration and have POTS at the same time. So now that we know the diagnostic criteria for POTS, let's talk about how they test for POTS. The gold standard for POTS testing is the tilt table test. How long your tilt table test will be also depends on who is administering the test, where you are having it done, the institution. Some of my friends have had tilt table tests where they had to stand for 45 minutes, an hour, 20 minutes. My tilt table test was 5 minutes. Every facility, every institution does it a little bit differently. For my tilt table test, it was part of my full autonomic testing. It was at the very end. So I had been supined for about 20 minutes. And while I was having this test done, I also was hooked up to an EKG. I had a blood pressure cuff on one arm, I had a blood pressure monitor on my finger, and I had my heart rate being monitored as well. When it came time for the tilt table test, they had me still lying flat. They took my heart rate and my blood pressure. Then they say, okay, we're going to tilt you up about 70 degrees. So then they tilt you up and then they just watch you. They just watch and you get to tell them, okay, I'm starting to not feel well. I'm experiencing lightheadedness, dizziness, I'm getting hot. And the whole time they are monitoring you really closely. They're looking at your heart rate, they're looking at your blood pressure, and they're taking note of all of those things, as well as your symptoms, of course, because if you're being diagnosed with POTS, you must be experiencing symptoms of orthostatic intolerance when you are upright. That's that third piece of diagnostic criteria we talked about. Now, sometimes during the tilt table test, if the provider administering the test suspects you might have vasovagal syncope, which is another type of dysautonomia, it's under that umbrella, they may administer nitroglycerin either through your IV or through a tablet that goes under your tongue. And that's because it can help induce a vasovagal response. So a drop in blood pressure, a drop in heart rate, many times leading to fainting. For me personally, I did not have an IV for my tilt table test. I did not have nitroglycerin. My test was very straightforward. So it really just depends on who's administering the test, what they think you have, and how they want to go about it. Now, tilt table tests can be expensive. They can be very hard to access, either because of financial reasons or because there are so many people these days in need of tilt table tests. There are many things that make tilt table tests difficult to access. So another option for POTS diagnosis is the active stand test. It's also called the poor man's tilt table test. It's important to note that new research found that the active stand test, the poor man's tilt table test, failed to identify 26% of adult POTS cases. And the findings were similar in pediatric patients as well. The active stand test failed to identify 60% of pediatric POTS cases, which then a formal tilt table test identified for both. So keeping that in mind, how do you do an active stand test? First, you're going to prepare to stand for 10 full minutes, standing still, not moving around, not sitting in between. So first, you're going to have to get your resting heart rate and blood pressure. So you're going to lie flat on your back supine position for 5 to 10 minutes. At the end of those 5 to 10 minutes, while you're still in the supine position, do not sit up. You're going to take your heart rate and your blood pressure. Those are your resting vitals. Then you're going to immediately stand and immediately take your heart rate and your blood pressure. Continue to stand. You're going to stand for 10 straight minutes. When you've been standing for 2 minutes, you're going to take your heart rate and blood pressure. When you've been standing for 5 minutes, you're going to take your heart rate and blood pressure. And when you've been standing for 10 minutes, you're going to take your heart rate and blood pressure. A lot of times, providers will do this test in office. Make sure that they're not having you sit in between. The POTS heart rate criteria was based on a resting supine heart rate and a standing heart rate. So if they have you lie down flat supine position, then sit for a bit and then stand, it's going to affect your results. If you do a poor man's tilt table test or an active stand test at home, please do not use it to attempt to diagnose yourself. Because of course there is more to the POTS diagnostic criteria than just did it go up 30 beats per minute or not. If you gather that information, it might be helpful to bring it into your doctor to say, I decided to do a poor man's tilt table test at home. Here are the results. I noticed that my heart rate did increase and it seemed to stay sustained for quite a bit. And I'm wondering if you think it would be worthwhile to investigate POTS, to potentially have formal testing done for POTS. But please do not look at it and say, oh my gosh, my heart rate went up for 30 beats per minute. I have POTS. We don't want to do that. We want to use it as a tool to help advocate for ourselves more effectively. What providers should you see to discuss POTS and to get POTS testing? Typically, there are 3 specialists you could see. Some of them may know more than others. Some of them might not know anything at all. It depends who you get. But you can try to see an electrophysiologist, cardiologist, or a neurologist. My POTS and IST were diagnosed and are being treated by a neurologist. Now, you might have heard of subtypes of POTS. In the past, these subtypes were used more widely. More emphasis was placed on subtyping POTS. Subtypes like hyperadrenergic POTS, hypovolemic POTS, neuropathic POTS. But top dysautonomia experts have explained that subtyping POTS oversimplifies a very complex condition. They're moving away from the subtypes because the same patient can fit into more than one subtype. And they also explain that framing POTS into strict subtypes can actually harm patients by making them think some treatments aren't for them when they might actually benefit from those treatments regardless of the label. For example, and we'll get into this very shortly, one of the things that doctors usually tell you when you're diagnosed with POTS is that you need to increase fluids and sodium. If someone is labeled with the subtype hyperadrenergic POTS, they may believe that they need to stay away from that increased sodium when in reality it might actually help them. The key is individualized treatment rather than subtyping. So what is the treatment for POTS? There's currently no known cure for POTS, but there are treatments that can help manage symptoms. As I said just a little while ago, when you are diagnosed with POTS, one of the first things they're probably going to tell you is you need to increase fluids and increase sodium. Why is that? Because many POTS patients have lower blood volume, and fluids plus sodium and electrolytes promotes blood volume. You might also be told to wear compression garments. But why? Remember earlier on in this video when we talked about how a POTS patient stands and their autonomic nervous system activates several responses, one of those being sending the signal to blood vessels to tighten. Since those blood vessels cannot tighten efficiently and effectively, the idea is that wearing compression garments, they'll often tell you compression socks because as we know, our our blood pools in the lower half of our body. The compression will aid in that vasoconstriction, which will then help blood get back up to the heart and brain. Medications are another treatment option. Many doctors will prescribe beta blockers like propranolol or metoprolol to help bring the heart rate down. There are blood pressure support medications like midodrine or fludrocortisone. There are medications that lower heart rate but not blood pressure like ivabradine, also called Corlinor. That's what I take. Now, if you're newly diagnosed with POTS, you probably have to begin the gargantuan task that is finding electrolytes that not only taste good but also help you. Might I suggest Vitassium? Our products are specifically formulated to support people living with chronic illnesses and to help manage symptoms of certain types of dysautonomia like POTS, listen to that, OH, VVS, and other chronic conditions. That many of us on the Vitassium team either have dysautonomia or love someone with dysautonomia, so we get you. That's why we not only offer free samples of our products you can order right from our website, you'll just have to pay $4.99 for shipping. In our sample pack, you'll get a 4 count of our electrolyte capsules, you'll get a 4 count of our fruit punch electrolyte fast chews, those are my personal favorite, I have them every day, and you'll also get a 4 count of our extra strength electrolyte capsules. We also have the Vitassium Club. Our Vitassium Club is a free program that provides discounted products and free shipping on certain orders for anyone that uses our products to help manage a chronic illness. So if that sounds like you can sign up for our Vitassium Club. Remember, it's free at our website, Vitassium.com. And that brings us to my favorite segment, common misconceptions about POTS and their truths. Let's correct them. POTS is just a high heart rate. Wrong. As we've learned in this video, POTS is an autonomic nervous system disorder, a kind of dysautonomia. Dysautonomia is the dysfunction of the autonomic nervous system. Autonomic nervous system regulates the involuntary responses of the body, heart rate, blood pressure, respiration, digestion, and more. So dysautonomia, POTS, causes dozens of symptoms across multiple body systems. It is way more than just a high heart rate. POTS is a fainting disorder. No, it's not. Only 20 to 30% of POTS patients actually faint. Most have never fainted and will never faint. POTS is a rare disease. No, it's not. Before the COVID-19 pandemic, Dysautonomia International estimated that there were between 1 and 3 million Americans with POTS. Since the beginning of the COVID-19 pandemic, there have been an additional 6 to 7 million new cases of POTS, and they think that's more on the conservative side. So POTS wasn't rare, and it's certainly not rare now. POTS is a heart condition. Wrong. And I bet you were expecting the answer to that one. As you know, we've touched on a couple of times now, it's an autonomic nervous system disorder, not a heart condition. To have POTS, your blood pressure has to drop. That goes against the diagnostic criteria for POTS, remember? The second piece of criteria to be diagnosed with POTS is there must be an absence of orthostatic hypotension. So again, there must be an absence of a drop in blood pressure of at least 20 systolic or at least 10 diastolic within the first 3 minutes of standing. Now you can have POTS and have a slight drop in blood pressure upon standing as long as your blood pressure doesn't drop too much, which then of course could indicate you might have a different kind of dysautonomia like OH. Only thin, white, young women have POTS. Absolutely not. Between 75 and 80%, and in some studies even up to 90% of POTS patients are people assigned female at birth. So they are the majority, but that does not mean that people who are not assigned female at birth cannot or do not have POTS. They do. Now, POTS is not a young person illness. Anyone can have POTS regardless of their age. So we know it's much more prevalent in people assigned female at birth. It is more prevalent in younger people as well. And by young, I mean 15 to 50 years old. So now let's address the thin portion of that misconception. Only thin people can have POTS. That's not true. My source is me, a fat person. I have POTS. So POTS is not exclusive to just people assigned female at birth. It's not just exclusive to young people. It's not just exclusive to thin people. It's also not exclusive to white people. Yes, about 94 to 96% of people diagnosed with POTS are white, but that's likely because of discrimination, lack of representation, lack of diversity in healthcare, and other barriers. POTS is not rare in Black, Indigenous people of color. It's just rarely diagnosed. And since we're here talking about barriers that Black, Indigenous people of color face in the medical system, here's an example specifically about POTS. A 29-year-old male Black medical student had to endure multiple tests and referrals, including a psychiatric evaluation, before a tilt table test was ordered and confirmed a POTS diagnosis. But because of the common misconception that POTS only affects thin, white, young women, his doctors questioned his diagnosis. He had to seek a second opinion, a third opinion, and undergo a second tilt table test before he could finally receive care for his correct POTS diagnosis. POTS is not exclusive to any demographic, and it's really important we keep talking about that. So now let's talk POTS comorbidities. Comorbidity refers to the presence of 2 or more conditions that are often co-occurring. So if you've been in the POTS space for a minute, you may have heard the term the trifecta. What is that? The trifecta is POTS, MCAS, which stands for mast cell activation syndrome, and EDS, Ehlers-Danlos syndrome. Those 3 are found together so often that they get their own little name, the trifecta. But what are some other comorbidities of POTS? This is an incomplete list because there are so many. Gastroparesis, ME/CFS, long COVID, autoimmune diseases, other types of dysautonomia, small fiber neuropathy, migraine, IBS, post-viral syndrome, like long COVID. So what causes POTS? Researchers are still working to identify the pathology or the root cause of POTS, but there are several underlying diseases or conditions or even factors that are known to cause POTS or POTS-like symptoms. Like we briefly touched on, EDS, Ehlers-Danlos syndrome, mast cell activation syndrome, or MCAS. Trauma, whether it's emotional trauma or physical trauma like surgery, like pregnancy, like getting in a car accident. Vaccinations can sometimes trigger POTS. MS, mitochondrial diseases, genetic disorders. I lost this clip, but what can worsen POTS symptoms? Humidity, not enough sleep, alcohol, big meals, especially high carb. For me personally, my biggest trigger is heat. If I get hot, it's over for me. All my symptoms are flaring up. So I try to avoid heat. I have really bad heat intolerance, of course, really bad temperature dysregulation. So I always have cooling products on me, neck fan, disposable ice packs, ready to go to save my life when I need them, which is pretty often. So now to wrap up this video, hopefully it's been helpful for you. Let's end with some POTS symptom management must-haves. Of course, electrolytes. I'm gonna remind you again about our Vitassium products. Our electrolyte fast chews are clinically proven to start working in under 45 seconds. That's a huge deal. And our electrolyte salt capsules make it easy to get in more sodium without having to worry about higher fluid volume, which is really helpful if you have a lot of nausea and GI bloating like me, and I can't really tolerate that much fluid volume. These are much better. Compression garments, they're going to help prevent blood pooling, they're going to aid in that vasoconstriction and hopefully lessen your tachycardia, which then of course would hopefully lessen your lightheadedness, your dizziness, your fatigue upon standing. As I mentioned a little while ago, temperature regulation products, things that can help make you cool and that can also make you warm. Neck or hand fan, disposable ice packs, one of those ice ring necklaces, or heating pad, hand warmers, layers. A favorite water bottle that you enjoy drinking out of. This doesn't really fit in anywhere specific in this video, but it's really important to acknowledge this. You can have a normal heart rate and still be experiencing debilitating POTS symptoms. And this is just another reminder to us that POTS is not a heart condition. We know there's more to POTS than just a high heart rate, so even if a POTS patient's heart rate is normal, they can still be experiencing all of these other autonomic dysfunction symptoms. Doesn't mean you're making it up. It means you have autonomic dysfunction. Hopefully this video is helpful. Let us know if you have any questions, and don't forget to head to Vitassium.com, set up for our free Vitassium club, and order your free samples. Once again, you just have to pay $4.99 for shipping, and let us know what you think.